All right. So once we log into the Clarity system, it's going to pull us into this home screen. So this is where the majority of your work is going to begin in Clarity. So this is where you'll look up existing client files to add enrollments for them and create new clients for the first time to add data and enrollments for them. And there's a couple places I want to orient us to in this home screen. So one up in the top left-hand corner, I'm shadowing Caritas as an example for training, but in like your left-hand corner, you should see the agency that you work with. Another place I want to orient us to in your home screen is up in the top right-hand corner, the search button. So in Clarity, search equals home. So I'm going to say that a lot in this training today, search equals home. So anytime you all are trying to navigate back to where you started, to look up a new client, to navigate back to a client's file, you're always going to want to click on that search button. Next, I'm going to orient us to the button right next to your search button in the top right-hand corner that's labeled caseload. So I'm going to click on this caseload tab so that we can look at what you can see within that. So under active caseload, this is where you'll see your active clients. So whenever you create an enrollment, it's automatically going to create this active caseload for you. Next to active caseload, you're going to see status due. We don't see anything here now, but this is another place where you'll see if annual assessments are due that you can check, in addition to having annual assessment alerts. So there's kind of multiple places that you can see that. And then the tab right next to status due that's labeled case manager, this is where you'll see direct referrals to your programs. So this was all within our caseload tab that's right next to your search button. So I'm going to click back on the search button. And two other icons I want to orient us to. One is up in the top right-hand corner, those little boxes, that icon. This is called your launch pad, or if you're a breakfast fan, this could be called your waffle. Okay, we've got a waffle person up front. Nice. So we're going to click on your waffle, and you're going to see some icons here. You're only going to see the icons that you need for your role. So I have some additional icons you're not going to see. That's okay. You'll probably see reports and calendar on your end, and we're going to cover those today in this training. Next little icon I'm going to orient us to is this envelope icon. So if we click on that envelope, I'm going to click on it now. This is where you can send secure direct messages with other Clarity users. So you can kind of coordinate about clients through this direct message to other Clarity users. So it's kind of like IM for Clarity. So if we wanted to send a message to another Clarity user, we can click this new message button in the right-hand corner of your inbox. You can select the agency and then select the staff that you would like to send a message to. Oh, yay, we have some excited people. We love to hear that in the HMIS department. So you can like write in a little message here. Probably you're going to be talking, coordinating services, but you can write little messages in there and send them to other Clarity users. So now I'm going to click back on the search button, and you'll also see, you won't see them now because we just logged in for the first time, but under recent client searches, you'll also see any clients that you recently worked with. So you can always click on their name from there. For the sake of training today, I know most of you will be working with clients that already have files in HMIS, but for the sake of training, we are going to create new clients together, because if we all use the same client, the system would like freak out. So I will show you all how to look up an existing client, and then we'll add some new clients together for the training. So I know that Shrek is in the Clarity system. So in Clarity, it's recommended to search by the first 3 letters of your client's first name, and then the first 3 letters of the client's last name. That's the recommended way. So I know Shrek is in here. So I'm going to search SHROGR, and then we're going to see Shrek pop up there. And if this is the client we're working with, always want to double check the social security number and the date of birth to make sure this is our client. And then it's really obvious, even whenever you're searching for a client, you'll see the release of information. They have one in the system. Yes, question? Yes, so we are talking with our vendor about having the same HMIS numbers potentially come over, but they may be new HMIS numbers. Or Haley, you knew, yeah.
They are going to come over. However, Clarity does use a new system for assigning IDs to clients. So clients that we add moving forward are going to have a Clarity client ID.
Mhm.
All clients will have a Clarity client ID. But yes, you can use the SharePoint ID to find your clients, but eventually we're all going to move towards using the Clarity client ID.
Yep. So once we add our clients, I'll show you where you can see their HMIS number and Clarity. But what Haley was saying is that if you're looking for a client that was in the community services system and you type in their SPID number into Clarity, it should populate that client as well. So now we're going to create 2 new clients. Also, really good for we really want everyone to follow along in the training site. And so if you need help or anything, just flagging one of us down, just so we can all learn it together. So we're going to go ahead and create 2 test clients in Clarity, and that's going to help us out once we get to household creation. So now I'm going to invite you all to create a user in Clarity, add a new client to the system. So you all can use really any celebrity name that you want, your favorite pop star, neighbor, pet name, whoever you want to use as your new client. We'll just want to make sure that they don't already have a file in Clarity. So my partner is a big Muppet fan, so I'm going to use Kermit today. So I'm typing in Kermit. I'm going to click search. No one shows up here. So now I'm going to click add client in the top right hand corner. So I'll give you all a few minutes to just type in a name in the search bar, and then you're going to click the add client button. And that's going to pull you into this screen where we'll add all their basic identifying info. But I'll give you all a moment. All right, everybody give me a thumbs up if you added your client. Okay, I'll give you all a little bit more time. Yes, so for the social security field, what we've realized is that if you do leave it blank, it's not going to let you to continue forward. So if you do have any clients that don't have a social or they don't want to provide their social security number, what you would do is put X's in that field. And then you would answer the data quality dropdown that I'll show you all in a second as client doesn't know or client prefers to answer. All right. Yeah, so we'll go ahead and fill this out. So I'm going to put in a fake social here. And then next to quality of social security number, I'm going to click on this drop down. And these are the same kind of data quality fields you would see in community services. So ideally, if we ask the client that question, they answer it. We want to select full data reported or approximate. Or if we ask a client a question and they don't know the answer to that question, we can select client doesn't know. Or if a client prefers not to answer a question, we can select that. And just like in community services, we really want to stay away from data not collected whenever possible. So that can really kind of hurt your data quality. That indicates that the question wasn't asked of the client at all. So I'm going to select full social reported. And then I'm going to put in a last name. We'll say Muppet. First name Kermit. Quality of name. Oh, the frog. Yeah, that's good. Kermit Frog. Thank you. My partner would be ashamed of me. Okay. Quality of name, we're going to select full name reported. Quality of date of birth, we'll select full date of birth reported. And then we'll enter a birth date for our client. If you do have the alias field, we realize not everyone has that, so we're going to be fixing that in the live site. But if your client does have a nickname that they like to go by and you have the alias field, you can enter that. Gender, we would ask the client what gender they identify with. We'll enter race ethnicity information. And if the race ethnicity options don't capture how the client identifies, then you have the additional race ethnicity detail where you can write in information too. And then we would ask the client if they've ever served in the US military, yes or no. I'm going to say no. Once you have all of those fields completed, all of the basic identifying info in line with HUD standards, then we want to click add record. But just want to make sure, is everybody with me? No? Okay. Hey, Haley, I think we have someone up here that, right here.
I did all the steps, and then when I pressed save, it went to a whole other person. Yeah. Okay, I'm gonna try again.
Yes. Yes, question? Um, oh, consent refused. Yeah, we always want to keep that toggled off, but I think it has to do with the ROI, like if they didn't give permission. But we'll want to keep that toggled off, right?
Yeah, so that you can if you want to keep it toggled off so we can coordinate services.
Yeah, so the question was around this consent refuse section here. If that's toggled on, it locks down the client so only your agency can view them. And typically we don't want that toggled on because we want other organizations to also be able to view the client's profile and coordinate services for them. All right, so I'm going to click add record. So we have our first client created. Now we're going to create one more test client. That's really going to help us out once we get to households in a second. So now once you clicked add record at the bottom, now we're going to click on your search button again, search equals home, and we're going to do the exact same thing. We're just going to create a second test client together. So, and this should basically be like the partner to the client you just created. So we're finding love in the Clarity system. We're going to create a significant other to the partner, to the client you just created. So I created Kermit. So I found out there's a Muppet called Janice. So, oh wait, oh well, Miss Piggy's already in here because I was going to use Miss Piggy. Yeah, she's already in here. And someone put a picture, which is kind of cute. So I'm going to use a random Muppet that I honestly don't know this Muppet, but her name's Janice. She's in the band. Okay. I know, Miss Piggy. I know. At one of my trainings, what was I using? And they put in the picture. Oh, I was using like Sandy SquarePants, and the user put in her picture. Okay, so I typed in Janice Muppet. I clicked search. No one is in here. So just like we did a second ago, I'm now going to click add client in the top right-hand corner. And we're just going to do the same thing. So now I'll enter all this basic identifying info for my second client that I created. And I'm not going to talk through this because we just did it. So just enter the same info. And, you might want to write down your clients' names or something so you don't forget them in the training. Okay, so once you have all of your basic identifying info completed for your second test client, now we're going to click add record again. And we're just going to continue forward with this client. So we're going to stay right on this client's profile and continue from here. Real quick, everyone give me a little pulse check. Everyone give me a thumbs up if you're with me. Okay, perfect. All right. So whenever you create that personal identifying info for your client and you click add record, it's going to pull you into the client's profile page. A couple of things you're going to see on this profile page. One is under unique identifier. This is the client's Clarity HMIS number. And then you're also going to see on the photo, you can click on this update profile photo, and that's where you could upload a photo for the client, but we're not going to do that right now. And then I want to orient us to these three icons that you're going to see on the right-hand side of the client profile. So one is your client privacy shield. So this is what we're going to touch on first. This is where we're actually going to upload the ROI. So we're going to do that in a second. So client privacy shield, really important. And then also we're going to see a client calendar and client reports. We're going to touch on each of these in the training today. We're going to start with the privacy shield. So this is where we're going to upload the client's ROI. So in community services, there was like an ROI tab. In Clarity, your ROI is uploaded in the client profile through this privacy shield, we also see a banner across the top that's notifying us this client does not have an ROI. So it makes it really clear. So you can also click on this manage button and upload the ROI that way as well. But we're going to click on this little privacy shield. So I just clicked on that. Privacy, you'll have the ability to change a client from public to private only if you were the agency that created the client. But we typically want to leave the clients as public, like we said earlier, so that other organizations can also view their profile to coordinate services. So next, we're going to add our release of information for this client. So we see our release of information, and then we see this little plus sign where it says add release of information. We're going to go ahead and click on that. And we're going to see our permission as yes. We basically always want to keep the permission as yes here. So just keep that as is. You'll have the start date for your ROI. We're going to say they're signing it today. And then the end date, it's 7 years. The system automatically calculates that for you. So you don't have to add 7 years, which is nice. And then your documentation dropdown. So in this documentation dropdown, you will see attached PDF. So if we select that, you can still upload the paper copy of your release. But also, and the way we're going to do our ROI today is if you click back on your documentation dropdown, we'll select electronic signature. And this is where the client would be able to sign the ROI electronically within your device. So we're going to select electronic signature, and then we are going to select e-sign document. And then you'll see your ROI populate. It's going to be the same ROI as the paper version. And we're going to say that this client is comfortable having their information in HMIS. So we're going to scroll down. We're going to check this box. And if you all are completing the ROI with a client this way, you'll want to make sure and hand the client your device so that they can, sign this on their end. So we'll scroll down. And we're going to say, yes, this client is comfortable with us talking about their case outside of HMIS. And then we're going to do a signature. This is where the client would sign, but we'll put in a signature here for the training site and then click apply. And then you'll also see the spot for your witness signature. So this is where you would sign the electronic ROI. And then also make sure and click apply. And then we'll click save in the bottom left. And you're going to want to make sure and click save changes. So you'll save at the bottom of that ROI and then click save changes. So now we have the ROI uploaded and we see that banner across the top disappear. Cool. So now I'm going to click back on the client profile tab. Yes, question?
If we need to keep a paper copy, would we be able to print a paper copy of the ROI that way, or would I still need to have to sign a paper? Does that make sense?
Oh, wait, well, do you mind repeating that question? I'm sorry.
If I need it also on paper,
Uh-huh.
can I print that off? Why did they just sign electronic?
Oh, yeah, I think you can print that one
Okay.
through there. Yeah, you should be able to. And just so you'll know, that ROI really mainly works the electronic one for individual clients, because in our electronic version, we can have signature boxes and we can have check boxes, but we don't have the ability to do like print boxes. So that only means that if you are working with like a household and you have dependents that you have to add to ROI, you would have to do a paper one and upload it. For now, we might be able to fix that going forward. Any other ROI questions before we keep going? Yes. Oh, really?
I was just curious if somebody else reported that. It was enough, but usually like clients, want to touch the screen.
Right.
I was just curious if that's something everybody else reported.
Yeah, that's a good question. So, okay. Yeah, so we have a couple people, if you're using like touch screens or touch pads, they're not able to sign it on the electronic version. So that might be another case where you would need to use a paper copy. But if you do have like a mouse, it should work. But okay, so next we're gonna move into creating a household. So if you all are typically working with individual clients, you won't really be working with households often. You do not need to create a household if you are creating a single client and enrolling a single client. But for those of you that work with households a lot, if you work with families, then this is where households become super important. So creating a household will allow you to create group enrollments for clients and also assign group services. So you're going to want to make sure and create a household if you have a group of clients that are interested in receiving housing and or services together through your program. So we're going to say that we're working with Janice. and she has a partner and they want to be housed together. So we want to make sure and add her partner to her household. So we're in the profile, and your household and how you manage your household is going to live on your right-hand side within the client's profile. So that's also a little different than community services. There's a household tab. So now this is in the client profile. So to create a household, what we want to do is next to where it says household members, we're going to click on manage. So we'll click manage. And then this is why it was really helpful that we created that second client up top. You should see the client you just created under recent client searches. And all we have to do is click on this plus sign to pull them into the household. You can also search for the client you created in your search bar. So in Clarity, it's really recommended when you're configuring your households to go ahead and add all the clients that you'll be adding to a household, because it will save you time in the long run. So under client searches, the other client that I added was Kermit the frog. So I'm going to click this little plus sign here. It's going to have this pop up where it's going to ask for the member type. And I'm going to select, we'll say significant other, and then I'll click save. So now we have a household created. You'll see them under household members. And your head of household is going to be indicated with a little asterisk. So if you hover over that, it will say head of household. We also see that there's not a relationship here. So we're going to click on the pencil next to Janet, and I'm going to, under member type, add a relationship. So I'm going to select significant other. And then you'll also see if you did need to exit a member from a household, all you would do is toggle that on and that would exit them. And I will say that if you are trying to exit your head of household, the system is going to prompt you to designate a new head of household before you can exit them. So really just best thing, if you're exiting a member of a household, just don't exit the head of household. You can do that, but it's a little bit trickier. So I'm going to click save in the bottom. And now we have this household created here. Next, before we move into an enrollment, I'm just going to show you all the history tab real quick. So up at the top, right next to your profile tab, you're going to see a tab labeled history. So this is the training site. We just created this client, so we don't have a lot of history here. But in the live site for your clients that have been part of the homeless response system for a while, you can see a lot of history for the clients. And it will be color coded. So you'll see program enrollments, services the client has received, referrals. And if you click on this little view button, this is where you would be able to search for specific pieces of the client's history once they have that. So we can maybe return to the history tab at the end of training and you'll see more information there for your clients. But next we're going to move into our program enrollments. So one of the first things that should be completed whenever you all receive a new referral to your program is creating their program enrollment. That's where we gather the bulk of our client data and where we're indicating to the system and to HUD that this client is receiving services through your program. So our program enrollment, just to be clear, that is like what we would call a program entry in community services. So that's what we're going to move into now. And after this program enrollment, we'll take a little break because we've been going for a little bit. So I'm going to click on our programs tab. So basically, anytime you all are entering anything around your enrollment, which used to be called program entry, you'll want to click on this programs tab. So we're on our programs tab. Under program history, once you enroll clients into programs, that's where you would see all of their other enrollments. And then you're going to see programs available. And this is where you'll see all the programs that you're able to enroll a client into through your agency. This is where it's really important to make sure and select your correct program that you want to enroll the client into. So if you all are kind of confused, you're not sure exactly which program to enroll your client into, just make sure to check in with your program manager because that's really important. We don't want to enroll a client into the incorrect program. So I'm going to go ahead and enroll this client into the Caritas My Home PSH program. So this is a rapid rehousing, permanent supportive housing geared training, but you can enroll them in whichever program you work with now. This is going to be geared towards housing though. So I'm going to enroll this client into Caritas My Home PSH. So I'm going to click on the little drop down next to that program. It would tell you if there were any other active clients, the other clients enrolled there. You'll also see service categories tied to that program. And then you'll see other group members. So this is really key. This is how you'll make sure that you're adding all of your household members to the enrollment if you need to. If you're just enrolling an individual, you don't need to toggle anything, but we want to make sure we're enrolling both Janice Muppet and Kermit Frog on my end. So I'm going to toggle on my other household member. And then once the household member is toggled on, I'm going to click this enroll button. Once you click enroll, that's going to pull us into our program enrollment here. And we're going to complete this together, and then we'll take a little break after that. And I am excited to show you all the conditional logic in this one. Okay, so we have our project start date. We're going to say we're enrolling this client today. Next to is translation assistance needed. I'm going to click on that drop down and select no. Relationship to head of household is populating as self, so I'm going to leave that as is. And then we have our housing move-in date field at the top of our enrollment. So for housing providers, housing move-in date, super important. This is, how we're capturing whenever clients move from homelessness into housing through our program. And so it's really important once we house a client to enter that housing move-in date if you are a rapid rehousing or permanent supportive housing provider. And so for some of you, you might create your enrollment at the time the client moves into housing. Others of you, you might create your enrollment and then they move into housing at a later time. That's kind of the example I'm going to use today. So we're going to say that we received this referral. We're providing case management for the client. We're working on locating housing for them, but they're not housed yet. So we're going to leave this housing move-in date blank for now. And I'm going to skip that and then move into our prior living situation. So this is the section where we would capture the client's history of their homelessness. So this is the section of your enrollment where we're looking at the past 3 years for the client. We're seeing how many episodes of homelessness they've experienced and how long each of those episodes lasted. And that's helping us determine if the client is considered chronically homeless or not. So I know y'all are probably really familiar with chronic homeless definition, but in case we have new folks, we'll just go through that really quickly. So a client is considered chronically homeless by HUD if they've been experiencing literal homelessness, so staying outside in shelter and car for the past year or longer with no breaks and a disability, or if a client has 4 separate episodes of literal homelessness over the past 3 years, and across those 4 episodes, it adds up to a year or longer of homelessness and a disability. So I'm in a PSH program now, so it should reflect that the client is experiencing chronic homelessness. For those of you that are rapid rehousing providers, of course, that's not a requirement. So in our learning management system, we have like a really in-depth video that talks about how to capture this, because usually you'll want to have like a piece of paper, you'll backtrack with the client. But for the sake of time today, we're going to say for our example that our client has been experiencing literal homelessness for a year or longer. So next to type of residence under prior living situation, this is where the client was staying right before they enroll into your program. And typically you'll ask, where did you stay last night or where did you sleep last night to capture that. So I'm going to say this person has been staying outside. So I'll select place not meant for habitation. And then we'll see our other questions populate here. So we'll say length of stay in prior living situation. So we said this person has been staying outside for a year or longer. We'll select that. And then approximate date this episode of homelessness has started. So start date of their most recent episode of homelessness, not homelessness in general. So I'm going to say that this client's homelessness started January 1st, 2024. And then number of times on the street in emergency shelter or safe haven in the past 3 years, I'll select 1 time. And then total number of months homeless on the streets in emergency shelter or safe haven in the past 3 years, I'll click on that drop down and select more than 12 months. So we see from this that this client is experiencing chronic homelessness. So next, we'll just keep moving through this enrollment together. So next we have disabling conditions. So this is where we'll ask the client, do you have a disability? I'm going to click on this drop down and select yes. And then typically if a client's brand new to my case, I'm not really familiar, I'll go through each one of the HUD considered disabilities. And that's mainly to make sure we don't miss anything. You might ask the client, do you have a disability? They say no. Then you go down the list and you realize that they do have one of these HUD considered disabilities. So we'd ask the client, do you have any physical disabilities? I'm going to click on that drop down and select no. We'll ask if they have any developmental disabilities. I'll say no. We'll ask if they have any chronic health conditions. We'll ask if they have any diagnosis of HIV or AIDS. We'll ask if they have any mental health issues like depression, anxiety, PTSD. I'm going to say yes here. And then for long-term, we typically always want to select yes, so that this counts as a disability for the client in this system. We'll ask if they have any history of substance abuse or drug abuse. I'm going to say no. And then the next question we'll ask is, are you currently receiving income from any sources? So I just want to show you, if you click on this drop down and select no, that's all you have to do. You don't have to move bubbles around and make sure that you have your HUD verification open or anything like that. You just select no and that's it. But we're going to say this client does have an income source. So if I select yes from this drop down, it will populate your HUD considered income sources. So I'm going to say this client is receiving Social Security income. So I'll toggle that on. And then all we have to do is enter the amount that they're receiving in SSI every month. So I'll put 836 here. If you click anywhere, then you'll see that monthly income amount populates there. So if they did have multiple income sources, it would calculate that for you. We'll scroll down and I'll ask the client if they're receiving any non-cash benefits like SNAP or food stamps. I'm going to say yes. It will populate those HUD considered non-cash benefits. I'm going to toggle on SNAP. And then 2 more fields here. I'll ask the client if they're covered by any health insurance. I'm going to click on that drop down and select yes. It will populate those health insurance forms. So I'm going to toggle on Medicaid. And then last question, and this only applies specifically for some enrollments, but it's going to ask for sexual orientation. So I'll select heterosexual, and then I'm going to click save and next, and it will automatically pull you into the enrollment for your other household members, which is nice. You don't have to find them or click on anywhere else. You'll just click save and next at the bottom, and it'll pull you into the next enrollment. So for this one, I'm just going to answer everything as no, except for relationship to head of household. I'll select head of household's partner. And actually, I'll put in the same history of homelessness here for the second client. And then I'm just going to answer everything as no on this one, but you all can answer this any way you would like for practice. But I'm just going to answer everything as no for the sake of time. And then I'll click save and close once you're done completing all the info for your second test client. All right, so once you create your enrollment, it's going to pull you into this screen where you'll see more information that you can add at the program enrollment level. So on the right, you're going to see days active in the program for the client. You'll see the number of group members tied to this enrollment on the right. You'll see their start date, assigned staff that are working with them, your head of household, and any other program group members there on the right. But we've been going for over an hour, so we're going to go ahead and take a break. All right. All right, everybody good to go? Yeah? Okay, so where we left off is at our program enrollment, which, yeah, there's kind of some, it's kind of echoey in here, so, you know, keeping the table talk to a minimum would be awesome. Okay, cool. So where we've left off was we completed our program enrollment. So that, I know I need to do like an attention thing. I know, because I'm like, I don't like to be like mean. Okay. So where we left off was our program enrollment. So that's really the bulk of your data entry whenever you're enrolling a client to your program. So we're going to pick back up where we left off. So we're in our programs tab. Can everybody give me a thumbs up if you're at this screen with me? Okay, cool. Great. Well, I just left that screen myself. So if you were at the screen I was just at, stay where you're at. Okay, I just clicked on something. But if you're not, how I got there and how you'll always get to the screen that I was just in is that you'll click on your programs tab. You'll see under program history your program enrollment, and you can click on the pencil next to it, and that will pull you into the screen. But if you're here already, stay here. This is where we're going to be. So at your enrollment level, there are some things that you can add that are associated with your program enrollment. So a kind of key difference between Clarity and Community Services is that you'll be able to provide services, notes, files at the program enrollment level for your clients. You'll also have the option to create notes, files at the more general client level. So basically anything that is connected to your program enrollment, you're going to want to make sure that's added at the enrollment level. So for instance, services, most of your services are going to be entered through the program enrollment level. So if you are like, for instance, putting in a service for a rent payment, a utility deposit, that's associated with your housing program enrollment. So you would enter that service at that level. A general client service, that could be like a bus pass, for instance, just like a general bus pass. So we're going to go ahead and we're going to provide a service for this client. So I'm going to click on provide services. So that's right next to your history tab. It's provide services within that program enrollment. So you'll see services associated with your program enrollments. Just so you'll know, we're very much still building out services. So if you don't see some of the services that you typically provide in the live site, our team can add more of those for you. We just kind of added some base level services to get us started. So let's say that we are providing a utility deposit, for instance, just to show y'all. So I can click on that utility deposit service. You can enter the amount and the funding source if needed, but we're still building that out. And then if you do need to enter any service notes, totally decided internally if you're required to enter service notes, but you can do that within this box here. So maybe we just need to put like provided utility deposit for August. And then we can enter submit in the bottom right-hand corner. And now that service has been provided. So if we click back, for instance, on the history, we should see that service there. So yeah, we'll see that service provided. And as you know, you're providing more services for the client, that history will grow within your program enrollment. Next, you can also enter notes at the program level. And then also you can add more general client notes at a client level. So if we wanted to click a note here, we could click add notes. You can title your notes. So I'm just going to title this like case management appointment. There aren't categories yet, so we'll select no category, and then you can put in whatever your case note is. So I'm just going to say, completed client enrollment. And then scroll down and click add record. So you can add notes there. We can also click on files, and we could select add file here, and this is where you could add files at a program level. Yes. Yes. So just in case anyone is kind of lost for how I got to this screen, if you're ever wanting to navigate to the screen to add services at a program level, notes at a program level, any of that information, how I navigated to this, and you can just stay here if you're already here. But how I navigated to this is I clicked on programs, and then under program history, you'll see the program enrollment you created. And then you'll just click the pencil next to your program enrollment under program history. And that will pull you into this screen where you can add notes and files and all of that at a program level. But now we're going to move up to the top here, and I'm going to navigate to the contacts tab. Yes. Yeah, so for notes, so typically if you toggle anything in Clarity to private, it's basically locking that down by your agency. But for notes, the way that we have the privacy setting for notes in general, it's already locked down by agency. So for notes, it doesn't really do anything different. Yeah, you're welcome. All right, so now we're in our contact tab at the top, and this is where we'll add client contact information. So within community services, your client's contact info is within their summary tab, if you all remember. But in Clarity, there's a separate tab for client contact information. And so just like in community services, clients' contact information is super important to keep up to date. Whenever clients do come up for housing referrals, that's the first way that staff will reach out to them to contact them. And then just for you all, really important to keep that up to date as well. So we're clicking on contact, and then we're going to click add contact in this top right-hand corner. And under contact type, we don't see other categories there. We are going to add some for the live site. because if you do need to add, maybe like a trusted family member or a friend that is another person that you could reach out to if you can't get in touch with the client themselves, you could add those contacts as well, and you would just label them from the drop down as the contact type. We're just going to be entering this client's direct contact info. So we'll enter an email. I'm going to say muppetsforlife@gmail.com. And then we'll put in a phone number here for the client. If the client does have a secondary phone number, you can enter that as well. And then you're going to see this toggle next to active contact. So you all can always update the phone number, email address within this contact. You can also toggle off the contact to show that it's inactive. So that would more come into play if you did have a contact for like a trusted family member or friend for the client, but then they don't have contact with that person anymore. You could toggle that contact off entirely. But otherwise, you'll typically keep it active and just edit it if the phone number changes. We'll put in the contact date. So this is just to record when we entered this contact information for the client. And then notes. So this note section is really important in your contact section. So basically in community services, we had some additional questions around contact info. So how does the client prefer to be contacted was one of them. Another one was where can we find this client if we're not able to get in touch with them by phone or email. So we would put those now within the notes for the client's contact. So maybe this client prefers to be contacted by phone. We would enter that in the notes section. And then maybe we know that this client typically goes to a drop-in center every Friday at 1, so we could put that. I'll say a client goes to Sunrise every Friday. And then we'll click Save Changes in the bottom left. If we click back on the Contact tab, we'll now see that this contact is entered. You'll see the phone and email listed and the date it was created. And if you did ever need to edit this contact info, you'll see a pencil here. So you can click on that, and that's how you can edit that phone number if needed. Now I'm going to click on our Notes tab at the top. So this is where we can add client notes as well. So you can also add it in this tab. So you would just click Add Note here if you needed to add additional notes at the more general client level. And also under the Notes tab at the top, this is where we see the public alerts. So like I said at the beginning of training, we're still kind of figuring out as a community how we want to utilize public alerts. But essentially, this is something that we could use for BOLO. So be on the lookout, and if clients come up for housing referrals, but staff are having trouble locating them, to let them know, we could issue a public alert across the system. So when staff log in, they'll see that across the top of the client's profile. So I am going to enter those just to show you all what this will look like. So next to public alerts, I'm going to click Add Alerts. Also, it's 11/11, Make-A-Wish. I'm kind of superstitious. Okay, so now under public alerts, let's say this client has an active rapid rehousing referral. So I'll just enter that. You can put in an expiration date here. So if we wanted to have this expire after 90 days or something, we can put in an expiration date. And then we can enter a note here. So we can say, maybe client has an active rapid rehousing referral with a specific program and tell them the staff to contact. Yes. And then you click Save. Yeah, so the way that we have the privacy settings for notes kind of across Clarity is that they're locked down by agency. So another case manager within your organization could see case notes you enter, but a staff at a different organization would not be able to view those case notes. Yes, I believe it's the same privacy setting for both. So now we would click Save Changes for that alert. Next, I'll show just files at the general client level. So kind of an example of a file you might want to add at the general client level as opposed to a file at the program level would be like an identification document for the client. So maybe you have a copy of the client's ID or copy of the client's birth certificate. You could really add that file at a general client level. So you would add that at the top here. So let's say we want to add a copy of this client's ID. I've clicked on File tab at the top, and then I'll click the Add File button here. And then next to Category, you can select the category for this document. So I'll select Personal Identification. And then next to the category, we can select the type. So I'm going to say Photo ID Card. And then we could click select file and you would select the document that you uploaded to your device to add here. Okay, next I'm going to click on location tab. So this location tab, this is where you can add addresses for your clients. So you could put like the address for their housing if they have a housing placement. This is always in addition to the housing move-in date. So housing move-in date, we're going to get to in depth in a second, but that's the really important field for entering housing. But you could also enter where the client was housed under this location tab. So we can click add address here. You can put the address type. So maybe it's home if the client is housed. You can name this. And then you can click add location. And this is where you would enter the address for their housing placement. This is totally different. This is for street outreach. If they're out in the field and they're visiting a client, they can actually click on current location and it will use like geolocation to pinpoint that for people that are out in the field working with clients. But since this is a housing gear training, we're gearing it more towards like a housing placement. So we can enter address here. I'm gonna try to enter a fake address, but I don't think it will let me. We'll see. And then you can click add. Yeah, it's not gonna let me. I'll just do current location. Okay. And you can toggle this as the active location, and then you can put the date that you're entering this, and you can also enter any notes about the client's location that you would like, and then click Save Changes. So next tab I'm going to navigate to is your last tab on the right, which is Referrals. I'm going to click on that, and we don't see anything here, and we're also still kind of configuring how we'll use referrals, but this is probably where you would see housing referrals through Coordinated Entry most likely, but we're figuring that out.
If I told you originally that I don't want it to know my location, how can I turn that off?
Let me see. So the question was if she toggled something on to make it to where you can't see the location, how would we switch that? Let me see. Oh, a browser setting. Oh, okay, it's a browser setting. That's what the group is telling me. Thanks, class. Okay. So now after referrals, next we're going to move into how to enter status update assessments for clients. So this is what used to be called interim updates. So what used to be called interim updates, we now are going to call those status updates in Clarity. So we're kind of adopting a little bit of new language, but it's basically capturing the same thing. So your status updates are measuring the change in the client's status after time in the program. So basically anything that changes for the client since their enrollment, you would add that in a status update assessment. So for instance, we're going to do an example of this. Let's say we're working with our client, I'm working with Janice, and let's say I've been working with her for about a month. Let's say that she got a part-time job, so she has an increase in income. And then also we're going to say she moved into housing. So really key when your clients move into housing, making sure that housing move-in date is entered in HMIS, because otherwise, if that's not entered, it looks like the client wasn't housed according to like HUD and HMIS. So we're going to click on our programs tab. So anytime you're entering anything that is involved with your program enrollment, you'll navigate to this programs tab. So we're going to click on our programs tab. Under program history, you're going to click on the pencil next to the enrollment you previously created. So we'll click on that pencil. And then where you would enter those status update is this assessments tab. So basically, y'all don't use assessments tab at the top. So anytime you're doing status update assessments, it's at the program level. Just want to note that. So under this assessments tab, you'll see status update assessment and you'll see annual assessment, which we're going to cover in a little bit. So we're just entering a general status update assessment. So we're going to click start next to status update assessment. And then you're going to see your other household members. If you were entering an update for both of them, you can leave them both toggled on. I'm going to toggle off Kermit and I'm going to say we're only entering an update for Janice. So you can toggle off your other household member you created. And then we're going to select add status assessment. Your status update assessments, they're going to have all the same fields as your program enrollment. You're just updating anything that has changed for the client. So we're going to say that, oh, that's not actually really good. Yeah, so this is where we put our date that we're entering this status update. We said we've been working with the client for about a month, so we'll enter September 21st, 2025. Now we're gonna say that we moved now we're gonna update the income. So we're gonna find our income sources. We're saying that this client has a part-time job. So we're gonna toggle on earned income, and then we'll say she's receiving about 500 a month. You can basically click anywhere on it, and you'll see that it automatically adds up that income for you. And that's also all you have to do. So you don't have to worry about dates, overlapping dates, open up your HUD verifications, all of that jazz. It's just a toggle. That's all. So if you needed to update anything else, you would do that the same way. But we're going to say that we're just updating income in the status update. And then it's notifying us, hey, this client does not have a housing move-in date. If they're housed, please enter one. Another kind of difference with Clarity, your housing move-in date, that field is just going to be in your enrollment. So it's only in one place, which I think is kind of nice for not being, having confusion around where to put it. So your housing move-in date is just in your enrollment. So we're going to click save and close from the status update. And then we're going to click on our enrollment tab. So this is where we entered all of that information at the beginning. So you'll click on enrollment. So I was just in assessments. I clicked on enrollment tab. And then we're going to enter our housing move-in date. And your housing move-in date should be the date the client physically moves into their housing placement or housing unit. So we're going to say they moved in on the date of this status update that we were entering. So we'll say they moved in September 21st, 2025. Then you'll scroll down to the bottom and click save and close. Couple things I want to note about housing move-in date. What happens if a client moves from one housing placement to another, right? So maybe you house a client and then maybe they're evicted or something happens and they're moving to a different housing placement. So if a client moves from one housing placement directly into another with no nights of homelessness in between, you would not touch the housing move-in date. And that is because if we did update the housing move-in date to reflect the second placement, it's going to look like that client was experiencing homelessness longer than they actually were. So the only time you'll do anything with this housing move-in date is if the client does enter into homelessness in between housing placements. So if that was the case, you would actually exit the client and then create a new enrollment the next day. And the housing move-in date would be left blank. You would enter a new one once they're housed again. If they're just transferring like directly into the housing placement, you still, although I don't know if the housing move-in date would transfer over. Clarity, you might have to add it again. So she's asking for the housing move-in date, what to do if it's like a transfer from one organization to another, basically. Like, yeah, so okay, so for transfers, once you create your program enrollment, you would just add the housing move-in date if they're housed at that time into that enrollment. Yeah. Awesome. Great question. Any other housing move-in date questions? Okay, cool. All right. So now we're going to do something in HMIS that sometimes is a little bit complicated and might not apply to everyone. So this would be, how do you handle a situation if a new household member is added to an existing program entry? So for instance, maybe I'm working with Janice and Kermit and they have a little Muppet baby and we need to add the little Muppet baby to our enrollment. Sometimes what we see in our system is that the little Muppet baby would just be on their own individual enrollment. And that's what we don't want to see that. So we want to see them pulled into the existing enrollment. So we're going to run through that. If you all typically work with individual clients, you may never run into this situation. But for those of you, if you work with families often or households, you might run into this sometimes. So I just want you all to know how to handle that in HMIS if it does come up. All right, so first step, if you're going to do this, the first step is we have to create the baby. So we have to add the child to Clarity. So I'm going to invite y'all to do this, especially if you work with this pretty often. So we're going to add the child to Clarity. So the way we want to do this is we want to click on the search button because search equals what?
Oh.
Yay, awesome. So we'll click on that and then we're going to add our child. I'm just going to name the child Cookie Monster. or my child. We can name the child anything. Oh, nope, it's in here already. Okay, I'm just gonna call it Baby Muppet. Okay, so you'll type in the name of the child you're adding to Clarity in the search bar. Click search. No one should show up under the results. So now we're going to click add client. And you'll enter all of that basic identifying info for the child. So I'm just going to do that real quick. Last name Muppet, first name Baby. The date of birth for the child, usually this would be, after that enrollment date was created, but the system won't let me, create a date that's in the future. So I'm going to say this child was born today, 8/21/2025. And then we'll click add record once you have that basic identifying info for your client, for the baby. We'll click add record. Also, we're going to go ahead and add an ROI for the child because sometimes the system won't let you create enrollment if they don't have an ROI. So we're just going to go ahead and take care of that. So I'm just going to click manage next to the child's ROI banner there. And I'll just click add release of information. The child would be, on one of their parents' their head of households ROI basically. So I'm just going to click on this drop down next to documentation, just select household to indicate they're added to another ROI. But you could also just click attach PDF and attach the ROI that they're on as well. So once you have that ROI information, you'll click save changes. And then I'm going to pause for a second, just make sure, is everyone with me that's following along on this part? Thank you. Okay, so now next we want to navigate back to our head of households profile. We want to add the child through our head of households. So we're going to click back on the search button to go home. And then you're going to pull up your head of household, which mine is Janice. So I'm going to type in Janice Muppet. And then click back into my head of households profile. And then we see that public alert I just created. So next we want to first add the child to our head of households household. So I'm in my head of households profile. Now I'm going to click manage next to the household. We see the baby that we just added under recent client searches, and we'll click the plus sign there. We're going to enter the member type as, we'll say, daughter. And then we're going to click save. The day that they were added to the household should match their birth date. And then I'll click save. Now we have the child added to the household. So that's the first step. We got there. Next, we're now going to pull this new household member into our existing program enrollment. So to do this, we're going to navigate back to our programs tab. It's basically always the first step if you're doing anything around programs. We'll navigate to the programs tab. Then under program history, we're going to click on the pencil next to that enrollment we had created. And then on the right here, underneath like the days active, all of that, you're going to see program group members. How we pull in the child to the existing program enrollment is we click on this plus sign. If you hover over that, it will say add. So we'll click on that. And then we'll just toggle on the child and then click enroll. And that's how we'll pull them in there. So we'll click enroll there. And then we would just complete this program enrollment. And if the project start date is different, you can edit it at the top there. So it's also kind of easier to do those little pieces too. So I'm going to say head of households child, and then I'll just answer this all as no just to make this quick. And once you have all that information filled out for the child that you just pulled into the enrollment, we can click save and close at the bottom. Does anyone have any questions about that or want me to go back through anything with that piece? Yes, yeah, I'll do it one more time. Yeah, I know this is like kind of a complicated thing in HMIS. I do think it's easier in Clarity, but it still has a lot of little moving pieces. So we'll do that one more time, and then we'll move on from there. Okay. All right, so I'm just gonna add another child as an example. Okay, yeah. All right. So first thing that y'all want to do is you're going to click on the search button to add the client to Clarity. So I clicked on the search button and we're going to add another child. Oscar the Grouch, is that Muppet? What's up?
Someone in the chat, asking about, with the baby being added, the program start date for the enrollment should be the date of birth.
Yes. Yeah. I'm just saying that, yeah, for sure. Yeah. So whenever you are adding a child that was just born to an enrollment, the date that they're added, the date they're added to the household would match their date of birth. So it's usually going to be a date that's after the date of the enrollment, but we can't like travel to the future in the training site. So, all right. So now we're going to add a child. I'm going to add Oscar the Grouch. Yes.
What if it's a child that was living with, say, a mother and father divorced,
Uh-huh.
and the child was living with mother, but something happened, so the child is going to be with the father now. Do we
Uh-huh.
still use their date of birth as their entry date?
I think it would be the date that they're being added to like your program and like receiving services through it. So yeah, this kind of is like a case of like the client's already enrolled and then the child is born. But if it's a situation of like changed custody or something, it would be like the date that they move in with that other family member. Yeah. Good question. All right, so we're gonna do this one more time. And then we'll move forward. So I'm going to add Oscar the Grouch here. Is that I think okay, so I'm going to click search and then I'm going to click add client. And I'm going to enter the basic identifying info for the child I just added. I'm going to label their date of birth as today. And then once you have all that info filled out for your new client, we're going to click add record at the bottom. Okay, are y'all with me? Create your new client. Okay, cool. So now what we want to do is we want to navigate back to your original client's profile. So your head of households profile. So we're going to click the search button again in the top right-hand corner to navigate home so that we can be in our head of households profile. So you're going to type in that head of households name in your search field. So I'm typing in Janice Muppet because that's my head of household. Oh, yay, someone added a photo. Wow, that's hilarious. Okay, so I love her. Okay, so now we're going to click on the head of households profile. So you search for them in the search bar, you see them appear, you're going to click on their name. All right. Wow, what a who. Whoever did that, thank you. Okay, so now we're going on your head of households profile. Over there, okay. Yeah, okay. So now we want to make sure we add that new child to your household. That's the first step. So you'll see your household members, click manage next to household members. Then under recent client searches, you should see the child that you just added to Clarity. So I added Oscar the Grouch as the second child. So I'm going to click the plus sign next to Oscar to add him to the household. Next to member type, I'm going to select son, and then I'll click save. All right, so did y'all add the child to the household? Cool. So next, now we're going to be able to pull them into our existing enrollment. So to do that, we want to click on our programs tab at the top. So we're going to navigate to our programs tab. Now we want to click the pencil next to our program enrollment. Slower. Okay. So we're going to click on our programs tab at the top. And then under program history, you'll see your program enrollment. We're going to click on the pencil next to that program enrollment under program history. So we'll click on that. Is everyone in that program enrollment screen who's following? They're good? Okay. So next to program group members on your right-hand side, you're going to see this little plus sign. next to program group members. And if you hover over that plus sign, it will say add. This is key. This is how we'll pull in that new household member. So we'll click add here. And then it was going to say enroll additional members. And you should be able to toggle on the client that you just added to your household. Which part? All of it? Okay. So to get here, I clicked on my programs tab. And then under history, I'm going to click on the pencil next to the program enrollment. And then next to program members on the right, we're going to see add. So we're going to click add here. And then we're going to toggle on our additional household member and then select enroll. Are we good over there? Yeah? Okay. We'll click enroll. And there we go. It added that new household member. Also, y'all, at the end, BitFocus has an amazing like help center where they have like guides for all these little pieces. It's like with screenshots. It's pre-created for y'all. So I'm going to make sure and point y'all to that resource at the end of training today. It's like literally what I use to learn how to do this piece. So now we have our project start date. We'll want to make sure that that's the date of the child's date of birth. And then I'm just going to enter this information real quick. So I'm going to say head of household's child and answer these fields as no, just for the sake of time. And then once you fill out all that information for that household member you just added, we'll click save and close. All right. So now we're basically going to get into annual assessments, and then we'll get into exit in a second. But first, I'm going to click back on the profile tab. So if you all want to navigate to that profile tab in the top left, just want to show you all. Oh, wait, no, it's actually the program level. Just kidding. Okay, well, we'll do this first. Okay, so in that client profile tab, we covered that privacy shield icon, but we have a couple other icons here that I just want to touch on. So one is your client calendar. So I'm going to click on the client calendar icon. And this is where you can add client appointments within Clarity. So it's kind of like another place that you could track if you have case management appointments. So let's say we have a case management appointment scheduled for this client on August 28th. We can put a start date here. We can enter an end date. Let's say this client appointment is happening at, we'll say 1 p.m. So you can put in a time and select done. And then we can enter an end time. So let's say 2 p.m. and click done. And then we can enter a location. Let's just put in my office. And then click save. Once you save an appointment through your calendar, you can now click on your Launchpad or your Waffle. That's something I haven't touched on since the beginning. So you can click on that Launchpad in the top right-hand corner and then click on your calendar icon. And this is where you would see all of your client appointments. And you can also merge your Outlook calendar with this calendar so that they basically copy over. Yeah, so we haven't really played around with that a ton as a team, but you can click subscribe to iCalendar, click open pick an app, and you should be able to select Outlook and merge those calendars together. Yes. Yeah, that's a great question. So I think what we've realized, at least now for the visibility for client appointments, is that you can just see it on your end. That's right, team? They can just see their appointments just as individuals. Yeah. Okay. Yeah, so the question was, if you enter a client appointment through your calendar in Clarity, can other agencies see that? Can other people at your agency see that? That's really just for you. But you can print this. So, if you wanted to print off all your client appointments for the month or print off client appointments for a specific client and hand it to them, you could do it. You could use it that way. So we're going to click back on search. Search equals home. We're going to navigate back to our head of household. So after you add the appointment, how you can view it is you'll click on your Launchpad, those little boxes in the top right-hand corner. You'll click on that, and then you'll see a calendar icon. And then you'll be able to see those appointments. Okay, so I'm going to click back on the search button, and I am going to type in my head of household, which is Janice, and then click the pencil so I can go into her profile. And you'll also see this little printer icon, and these are like client level reports. We're not really going to cover those reports in this training. We're going to cover more like data quality reports at the end of the training. But just to show you, you can click on that little printer icon, and it's basically like reports to, you could run one for your case notes, but it's kind of more like basic reports. So we're going to cover different ones later. Now I want us all to click back on our programs tab, and we're going to cover annual assessments. So I clicked back on my programs tab at the top, and then again, I'm going to click on the pencil next to my program enrollment, and I'm going to click on the assessments tab. So this is where we put our status update assessments. Your annual assessments live in the same place. So annual assessments, those are only required if you all are serving clients for a year or longer. So this might be kind of review for some of you, but annual assessments are due on the anniversary date of your client's program enrollment, and you have a 60-day window to complete those. So those can be completed 30 days before the anniversary of the program enrollment or 30 days after. And kind of what used to be a bit of a struggle was knowing when to complete them and tracking that. So this system does have alerts. If you want to make sure your alerts are on for your annual assessments, if you're in a program that completes those, you'll see down at the bottom on the right-hand side of this screen, you'll see assessment due every year notification. It says off right now. We can click on this little bitty pencil at the bottom next to the red off. It's going to say okay, and then you can just toggle on your assessment due warning and then click save changes. So first click, we clicked on the very first click, we clicked on programs tab. Then you click on the pencil next to your program enrollment. And that's going to take you to this screen where we have all of our assessments, services, notes, all that jazz. On the right, on the bottom, you're going to see this pencil. And yours is going to say off right now. So you'll just want to click on the pencil. It says on? Okay, good. Yeah, I mean, it should be on because we put like the annual assessment alerts across the system as on, but for some reason mine hasn't been. So you can also manually edit that. Yes, question in the back. So it's going to, if you do change the assessments to every year notification, it would change that across your agency. Yeah, so that's why it kind of gives you a notification of like, you're changing this for other people. So yeah. Okay, so we're going to click on our assessments tab within our program, and we're going to see this annual assessment. Your annual assessment, again, it's the same fields as your enrollment and the same fields as your status update. And it's just checking to make sure that all of the client's data is still true annually. So if you've really been keeping up with those status updates, you know what's going on, you've been updating it as things change, you might not have to enter anything at all at the time of your annual assessment. So next to annual assessment, we're going to click this start button. And for annual assessments, you're always going to complete these based off of your head of household enrollment date. If your other household members have different dates, you're completing it based off your head of household enrollment date as far as when it's due. But you will complete it for all members of the household. But just for the sake of training, I'm going to toggle these off. You would not do this in real life, but I'm going to toggle my other household members off for the sake of time. And then I'm going to click add annual assessment. And this is where we would go through and we would edit anything that we need to that's changed for the client, just like you would in a general status update. We're going to say this is all the same. So we'll scroll down and then click save and close in the bottom. Does anyone have any annual assessment questions? Okay, should be easier to track when those are due, so that'll be nice. Yeah, I don't know. What happens if they miss their annual assessment? What happens to them? Okay.
So you'll just need to, you'll need to collect that information in.
Do we have backdate mode in Clarity? They need it.
Well, we don't have that turned on in community services for folks.
Yeah.
So we won't have it turned on in Clarity, but you can, I think you can backdate in Clarity as well.
Okay.
So you'll want to go ahead and do that if you do miss the date for annual assessments.
Okay. Yeah, so if you do miss kind of your deadline for your annual assessments, you'll still want to enter them. And let us know and we'll probably be able to turn on backdate mode for you, potentially. Okay. So let me make sure I'm not missing. Yeah. Yes. Like the EDAs. You don't. Yeah. So that's kind of cool. EDAs are like gone. So you just have your agency and then you like select your program from those drop downs. So you don't have to switch EDAs. You don't have to do any of that anymore. So yeah, should be easier. That's also going to help a lot with our data quality. Dang, people like that. I need to mention that more in the training. Okay. So now last step, we're almost done. Oh, yes, question. Oh, really? It should have saved those. So I'm not sure why that would happen. But yeah, it should save it and pull it into where your annual assessment is. So sometimes it is important to like make sure that what you're entering saves. And sometimes if there was like a field left blank that's required, it won't let you save it. So if you like didn't enter a required field and click save, it wouldn't have recorded that. So that could be a situation. Oh, okay. The cascading. Oh, gotcha.
Is the status update post-dated? Because I know when we did an example, we post-dated it to September. So if you posted it to September and you're doing an annual assessment from August.
Yeah, it might be a cascading data situation. So
Programs in the training site aren't quite all set up as cascading.
okay.
And then, but in the live site, when we have made a decision about what the settings are gonna be, if cascading is gonna be allowed, when it's gonna be allowed, and then how long it'll be.
Okay.
That all of your programs will be configured. Still, we have like 9 days or 10 days to get that locked down.
Okay. Yeah. So that probably had to do with, cascading settings, and we're going to be configuring that more for the live site. But good questions. Any other questions before we move on to exit? Okay. So last thing that we'll want to make sure and complete for the client, this is like your last piece, is exiting the client. So once you're no longer providing services for a client, we want to make sure and exit them. That's really important because we want to make sure we don't have a bunch of open enrollments in our system for clients that we're no longer serving. So to complete an exit, you'll click on this little exit button within your program screen. If you're here, stay here, but I'm just going to show y'all again just how to get here in case people went anywhere else. So we click on our programs tab. We click on the pencil next to the enrollment that we created. That's always going to take us to that screen where we can enter additional info. So now we're going to click on this exit button on the right. And I am going to go ahead and toggle on the other members of my household and exit all of them. So toggle on all your household members and then select end program. So now we'll put a project exit date, and it's going to need to be an exit date after that annual assessment we created a second ago. So just to be safe, I'm going to exit this person October 1st, 2027. Then we want to enter the destination, so where the client is exiting to from our program. So if we're able to. So this is where we're indicating, is the client exiting into housing, back into homelessness, into an institutional situation, moving in with a family member or a friend. So we would select the appropriate destination here. Of course, sometimes you may not know where a client exited to. Maybe this client kind of fell off the radar, so we would have no exit interview completed. But ideally, we'll know where our client exited to. So I'm going to say they're exiting into housing. So I'm going to say rental by client with an ongoing housing subsidy. And then for rental subsidy type, I'll say that this person we'll say like a housing choice voucher. So I'll click on that. And then at the time of exit, we do want to double check that nothing has changed for the client at the time they're exiting, if we're able to. So we want to go back through disability, income, non-cash benefits, just to check on that. And so I'll scroll down to the bottom. I'll say everything is still the same. And so then I'll click save and next, and we'll just complete that for all of our other household members. So I'm just giving them all the same destination exit for all my household members. All right, and once you get to your last household member, instead of save and next, you're going to see save close. So we're going to click on that. And now the client has been exited. So you'll see those exit dates on the right. So last thing we're going to cover before we open the floor for questions for the rest of our time is we're going to run a couple of reports. So we're going to click on our Launchpad or our waffle. That's where you're going to really be able to navigate into most of the reports that you have access to in Clarity. So we'll click on our waffle, and then we're going to click on the reports icon. So a little waffle, and then click on reports. So these are all folders where different reports live that you all have access to. So you really have access to a lot more reports as just general Clarity users. The two reports we're going to run today are going to live in this HUD reports folder. So I'm going to click on this drop down next to HUD reports. And then we're going to scroll down to the bottom and we're going to find the HMIS data quality report. So that's the first report we'll run. You'll see these little stars next to the report. So that if there is a report you run pretty regularly, you can click the star to add that to your favorites. You can click run and run this now, which is what we'll do for training today. You can also click schedule to schedule this to run in the future. So I'm going to click on run. Sorry, I was getting a sip of water, but it was like really noisy. Okay, so we're going to make sure we select our agency. Next to COC filter category, we'll keep this as agency COC. Then next to COC, we'll keep Austin Travis County selected here. Next to project types, we'll select all. Next to program status, we'll select all programs. And then under programs, you'll want to select the program that you just enrolled that client into. So I enrolled them into Caritas My Home PSH, so I'll keep that selected. And then we're going to select a report date range. So I'll run this through the end of September. So I'll do August 1st, 2025 to September 30th, 2025. And then you'll have your export format. So you can choose web page, PDF, Excel. I'll just keep this as a web page. And then I'll click submit at the bottom. Once you click submit on that report, you'll see this report queue at the top. So you can click on that and it's going to say pending. And so while we're waiting on that report to run, do you all have any questions that you weren't able to ask? Yes. DLA 20s. Haley, do you happen to know that? Sweet, yes.
For SSB, if we have to do monthly repository reports, where can we locate that? Yeah.
Do y'all know where you can locate monthly repository reports? Under HUD reports? Okay, let me see. So HUD reports, and then
Like you'll go, instead of going to the client report area, you'll go to the waffle.
oh yeah, I'm in the waffle.
Oh, okay, cool.
And then I'm under HUD reports, so
I think it's HUD reports.
it might be a different folder.
Typically, when we enroll, it's under VA HUD, not HUD. Excuse me. That's like where it's not HUD. It's VA. It's specific.
Okay. Well, we'll find that report for
Okay.
you. We can
Sounds
let
good.
you know.
Appreciate
Yeah,
it.
but it should be in there. Okay, so this report is done running. So you can click on your report queue at the top, and once that says processed, we can click open. And that will pull us into the report. So this is kind of like a typical data quality report. You're going to see total number of people served in your program. And this is just running this for the training site, so we don't have a lot of data in there. But once you're in the live site, you'll see your actual client data. So total number of people served, number of chronically homeless individuals. If we scroll down, we have our data quality section. So we see that for name, social, date of birth. And so if there was any information missing, we entered it, probably most of us did, but you would see if there was anything missing. And then if you want to kind of investigate that further, like I can click on this number 1 next to the social security number, and it will show me the client who answered that they don't know for their social. I know. Universal data elements, so I'll have veteran status, project start date, relationship to head of household. And then if you scroll down, you'll see income information, information around number of chronically homeless individuals, timeliness of data. So that's just kind of the basic data quality report. We do have time, so I'm going to run one more report, and then we will open the floor for questions or get out early, maybe. So I'm going to click on our Launchpad icon again, and then I'm going to click on the reports icon. We're going to scroll back down to our HUD reports folder. And then I'm going to run the APR. So that'll be the last report we run. So I'll click run next to the APR. And it's really similar field. So we'll have our agency selected, agency COC next to COC filter category, Austin Travis County. For project types, we'll select all. For programs, I'm just selecting the program I enrolled the client into. We'll keep this as not based on funding source next to funding criteria. And then for the report date range, I'm doing the same date range. So I just am doing mine for August 1st, 2025 to September 30th, 2025. I'll keep the export as web page. And then at the bottom, once you have all of those prompts completed, we'll click submit. All right. And any questions while we're waiting for this last report to run? Yes.
Are there custom reports?
I think at some point we will be able to make custom reports for you all. What team do y'all know about custom report?
Yeah, so that'll be kind of the next wave, if you will. So after our go live date, we will still be working on migrating data over. And then we will hopefully be working on some custom reports in our reporting folder. But we won't be able to tackle that until we get more.
Totally fair.
But yes, we will have that on.
Thank you.
Yeah.
Thank you.
There's APIs
You just made me very happy. Thank you. Appreciate that.
Okay. This should be done in a moment. Any other questions while we're waiting? Probably take like another minute.
Okay, I'll come over from the other system or not.
Yes, case notes will come over. But basically what's going to migrate over first is all of like the HUD required fields. So like your enrollments and things. And then case notes will come over. So it might take a little bit, but they are going to come over. Yeah, so if anyone does have questions about the migration piece, y'all are welcome to ask questions about that, and our team can help answer those. Okay. Yeah, sure, we have any moment. It's gonna be done in just a moment. Also, y'all are great. I know this is a long training and it's a lot of information. We are going to have this training recorded. We'll put it on our Echo website so you can revisit it. And this is really the first of like mini training. So our goal is to kind of train as many current HMAS users as possible prior to go live. So you'll have some kind of like base knowledge. And then we'll have trainings on an ongoing basis that will really be designed for new HMAS users, but you all can attend some of those as like a refresher. So this report is done. So we'll click here and then click open next to the APR report we just ran. So in this report, there are some overlapping elements to the data quality report we just ran. So the top of it looks really similar with total number of clients served, veteran breakdowns, number of chronically homeless individuals. You'll see those same data quality sections for your universal data elements. And then if we scroll down, you can see data quality for timeliness of data, number of people served in the program. You can see the total number of people that moved into housing under this number of persons served, the Q7 section. And then if we keep scrolling, we won't cover all of this report. It's really massive, but you can see gender breakdowns for your clients that are enrolled, age breakdowns, race, ethnicity breakdowns here. You'll see more of a disability detail in this report. So it's a pretty massive report. This is a one that's run really commonly. It's basically like the APR for clarity. So I'm going to go back into our little slideshow